Good afternoon. I'm Alice Gaynor. Right now, the New York City Health Department is updating the public on our deadly flu season. It is after two young children recently died from the virus. Let's listen in.
And also by our new Health Committee Chair. We're pleased to have Councilmember Mark Levine. And I thought, where is my Assistant Commissioner? She's height challenged. Sorry. Dr. Jane Zucker. Dr. Zucker leads our Immunization Bureau and is our in-house expert on vaccination. The flu season runs from October 1st through May. All those months, we monitor the presence of flu in our city and across the state. That's when surveillance occurs. This year, the New York State Health Commissioner, who announces this every year, announced that flu was prevalent across the state in mid-December. But it does run all the way through May, so that's why it's important to continue to get across the message that we'll be giving you repeatedly today, that it's not too late to get a flu shot. The Health Department in New York City's primary role during the flu season is to monitor the occurrence of flu and to ensure that we keep the public apprised about the disease and what they can do about it. Over the past several months, we've seen an early surge in flu activity in our city, in our state, and across the nation. We, as part of our surveillance efforts, monitor emergency department visits for influenza-like illness, and you'll see in a graph behind me that we have marked the most rapid rise there in the red of flu-like illnesses in our emergency departments and outpatient clinics than we've seen in recent years. They now account for 6.5% of all emergency department and outpatient clinics, and it's the highest that we've seen in the last 4 years. We also, yesterday, reported tragically that there have been 2 child deaths, 2 pediatric deaths associated with the flu. So it's very important to remind New Yorkers that the flu is not the sniffles and a cough, that there are many people who die of influenza-related illnesses, and we lose more people to influenza and pneumonia every year than any other infection. In 2015, the most recent year for which we have data available, 2,094 New Yorkers died of influenza and pneumonia being an important complication of influenza. And almost all of those deaths, 90%, occur among people who are 65 years or older. The number of pediatric deaths varies year on year between 0 and 8. We usually see well under 10 pediatric deaths a year. This past year, there were 106 pediatric deaths nationwide, and there were 6 in New York City. This time last year, there had been 4 pediatric deaths. I want to remind New Yorkers again that there is still time to get a flu shot. The flu shot can be administered even after the flu season begins. We hope that people will get their flu shot in September and October, but it still will provide immunity. And importantly, even if it doesn't keep you from getting the flu in the first place, which is what we want the vaccine to do, it does ameliorate the symptoms of the flu and reduces serious complications of the flu, and in pediatric cases reduces the chance of death. The vaccine is readily available across our city. It's available in commercial pharmacies, in both private and commercial chains, in doctors' offices, in the city's public hospital system, as well as in our city clinics. And in the public hospital system, it's typically free or covered by a copay. In fact, in all of these settings, the flu vaccine is typically covered by insurance, and in the city's facilities, we never deny services for people on the basis to pay. It is not a hard shot to get. I give one to the mayor every year. He survives it without much complaint, and it has very few complications, just local soreness at the injection site. So if you want to get a flu shot and you haven't gotten one yet, it's not too late. Just check with your medical provider. As you know, the governor issued a proclamation that pharmacies can vaccinate younger children, children under the age of 18, and he gave permission to them to give vaccines to children 2 and older. This may vary by particular pharmacy, and we urge people to contact their child's doctor if they want to get them vaccinated. If you don't know where to find a vaccine, just call 311, or you can go online and find our flu vaccine locator, or you can text flu to 877-877 or gripe to 877-877. So I now want to turn it over to our Commissioner of Consumer Affairs, Commissioner Salas. Maybe you can summarize a few of the things that I've said in Spanish,
Yes.
and also remind everyone of the importance of using your sick leave. That's why we have it. Commissioner Salas.
Thank you, Commissioner Bassett. So let me just first say a couple of things in Spanish and in summary of what Dr. Bassett just reminded us of. Y el mensaje más importante es que no es demasiado tarde para tomar la vacuna en contra de la gripe. Es importante que salgamos a tomar la vacuna. Así no impida por completo que uno coja la gripe, por lo menos va a ayudar a que tenga unos síntomas más leves. Como dice la doctora Bassett, también esta vacuna está disponible en toda la ciudad, llamando al doctor, puede ir a las clínicas, a los hospitales. Si tienen una dificultad de encontrar una cita para la vacuna, puede llamar al 311 o mandar un texto al número 8787 con la palabra gripe. So now let me say a couple of things about the New York City paid sick leave law. So it is a really bad season, and we want to make sure that people are taking the time to take care of themselves and their relatives, their loved ones. If you have the flu or flu-like symptoms, you should stay home from work and rest. If your child is sick, do not send him or her to school. New Yorkers do not have to choose between their paycheck and caring for themselves or their loved ones. Thanks to New York City's paid sick leave law, you can take time off work to go to the doctor or simply to stay home and get better, and you will get paid for the time that you took. If you work 80 hours or more a year, you are entitled to paid sick leave. The law covers full-time and part-time employees. It covers employees in transitional job programs, undocumented employees, employees who are family members but not owners of the business, and employees who live outside of New York City but work in the city. We also want to remind businesses that they are required by law to provide this leave. If you're a business in New York City, you must allow an employee to accrue 1 hour of sick leave for every 30 hours worked, up to a maximum of 40 accrued hours in a calendar year. Now, for those employers who do not front-load sick leave on the first day of a new calendar year, you must carry over up to 40 hours of unused sick leave from one calendar year to the next calendar year. DCA's Office of Labor Policy and Standards is the office that is charged with enforcing, and it's an office dedicated to providing a voice for all workers in New York City. If your employer denies you sick leave or retaliates against you for using sick leave, DCA can help. For more information or to file a complaint, please call 311 or visit nyc.gov/paid sick leave. I hope that everyone's advantage of the right to paid sick leave, a law that is designed to keep New Yorkers healthy and safe. Y ahora para recordarles en español un poco acerca de la ley que tenemos de días de enfermedad pagados en la ciudad de Nueva York. Es importante que si usted está enfermo o tiene un hijo que está enfermo, no lo mande a la escuela, tome el tiempo para recuperarse, para ir al doctor. En Nueva York, los empleadores tienen la obligación de darle a uno hasta 40 horas de días de enfermedad pagados al año. Si usted trabaja por lo menos 80 horas para un negocio, usted tiene derecho a esos días de enfermedad pagados. Así trabaje tiempo completo, tiempo parcial, así sea un empleado sin tener documentos para trabajar, pero está trabajando y si trabaja en Nueva York pero vive afuera de Nueva York, la ley también lo protege. Entonces, queremos recordarle a los negocios que es una ley que tiene que de verdad proveer este beneficio a los trabajadores. Y como dije, como dije en inglés, uno acumula como 1 hora por cada 30 horas de trabajo que tiene. Y para los negocios que no le dan a uno al principio del año las 40 horas, ellos tienen que permitirle llevar las horas que uno usó el año pasado. Nuestra oficina en la agencia del Departamento de Asuntos del Consumidor, tenemos la oficina de Asuntos Laborales, que es la oficina que se encarga que se cumpla esta ley. Así que si usted es un empleado y se le han negado sus derechos, puede llamarnos al 311, puede conectarse con nosotros por nuestra página web en el nyc.gov, Paid Sick Leave. Y esperamos que de verdad aprovechen de este derecho que tienen. Es una ley que ha sido designada para proteger a los neoyorquinos y mantenerlos saludables y seguros. Muchas gracias. And now,
Thank you. Thank you. Yes, so now I'm going to introduce our Health Committee Chair, Councilmember Mark Levine. And I just want to note that it's how important it is for people to stay home, to avoid being contagious to other people, as well as to look after themselves. We recommend that people be afebrile, meaning no fever, for 24 hours before they return to work. And that's it for me as the city's doctor. I'm very pleased to introduce Health Committee Chair Mark Levine.
Thank you, Dr. Bassett, and thank you, Commissioner Salas. You know, there are more people dying from the flu and its complications in the city every year than die from homicides, car crashes, and opioids combined. This is a deadly, serious crisis, and we need to combat it on many fronts, and that's a responsibility that all of us have, starting with the responsibility we have to get a flu shot. And there's really no excuse for not getting a flu shot. They're available all over the city in pharmacies, in clinics, and even those who unfortunately would not have health insurance or could not afford can go to any health and hospitals facility and get a flu shot for free. And we have to combat the misinformation out there that these shots are ineffective this year. We actually don't even have the data on that and won't for another week or two, but every scientist in the country will tell you that getting a flu shot reduces your chance of contracting the flu, and if you should still contract it, it will lessen the symptoms. So everyone needs to get that shot. But that's not it. If despite all these efforts, you should come down with the flu, you have a responsibility to not spread this disease to other people. If you have a terrible migraine headache and want to go to work, we strongly advise against that, but migraine is not contagious. With contagious diseases, you're putting other people at risk if you expose them. And you now have the right in the vast majority of workplaces in New York City to be paid to stay home if you are sick. And that's why we passed this law. Passed it originally in 2009. We expanded it dramatically in I think we passed it originally in 2013 and expanded it in 2014. And we fought to get New Yorkers this right precisely because of situations like this, precisely because of our fear, not only for the welfare of workers, but for the welfare of all of us when people who are contagious are forced to go to work because they would face economic consequences if they didn't. So we've taken that excuse off the table. You heard Commissioner Salas explain to you that in the vast majority of workplaces, you have 40 hours of compensated time if you are legitimately sick to stay home and get better before you take yourself back to your workplace where you might make other people come down with the sickness. So this has to be a team effort in the city, or all of us are going to pay the price. And we're going to continue to face death rates that are unacceptably high. So we need everybody to do the right thing and get a flu shot. It's not too late. And those of you who do get sick, we need you to stay home where you will not put other people at risk. Brevemente en español. Si usted tiene gripe y usted va a su oficina a trabajar o donde usted trabaje, usted no es un héroe. Usted está siendo irresponsable, porque usted puede contagiar a más personas Así que si usted tiene gripe, quédese en su casa. Usted tiene derecho, bajo las leyes de esta ciudad, a quedarse en casa con pago máximo de 5 días al año. Use ese derecho. Usted tiene ese derecho por alguna razón y es por momentos como este. Si usted tiene gripe, quédese en casa. Protégese a sí mismo y a los demás neoyorquinos. Usted tiene ese derecho y tiene esa responsabilidad. Y si todavía no se ha puesto la vacuna, queda todavía tiempo. La temporada de la gripe puede durar hasta mayo. Así que váyase de una vez a buscar esa vacuna. Y si no tiene fondos, no se preocupe. Puede ir a cualquier hospital o clínica pública y se lo dan de gratis. Thank you very much.
Thank you very much. So we'll now be happy to entertain some questions.
Dr. Bassett, we know that the first child was from Wolf City. What can you tell us about the second child tonight?
We don't release protected personal information about cases, so that information is confidential. We would not have released the information that the press published about the child that you just mentioned.
We have 2 children.
Yes, there have been 2 pediatric cases that were fatal in New York City. They were confirmed by us yesterday, and we reported that.
How many adults?
We don't have that information. The pediatric cases are reported to us. The adult cases are reported to the state, and we don't have them in real time. We will have them, as you heard, when we close our mortality data. But we do have information on the number of laboratory-confirmed cases, on the number of emergency department visits, and the number of hospitalizations. In our city and in our state, those continue to rise.
Most of those fatalities, are there underlying cases as well?
The vast majority of fatal cases of the flu occur in people over the age of 65 and among people who have other health issues. We are always concerned every year that the groups that we consider high risk, that means people who are older and people who are very young, people with chronic conditions that may affect their ability to fight disease, have a vaccination coverage of about 67%, about 2/3 have been vaccinated. That means 1/3 haven't, and we really want everyone to get the vaccine.
Did the 2 children that died get vaccinated?
As I said, I'm not going to speak about individual cases, but I think you've asked an important question about vaccine coverage in pediatric cases. And in general, not speaking to these individual cases, we see very few children who have fatal flu have been vaccinated. The majority are unvaccinated.
Are you considering making flu shots mandatory for students?
Well, as you know, the city sought to make flu shots mandatory in our daycare facilities, and we were overturned in the courts. So we have that on appeal. We wanted to make it mandatory in our child care settings, and when we did, we had higher vaccine coverage rates in children. The state is the entity that would have to decide to make flu vaccine mandatory in schools. The city doesn't. At present, we're in the courts over our legal ability to make such rules. So I'm going to raise it again with Commissioner Zucker, but we don't have that mandate at present.
Do you communicate with the Board of Ed about where these children went to school and if if other students' families should be notified that the fatalities were in those schools? Do they do extra cleaning? Is that anything you communicate as a health department?
Well, I'm sure that the tragic loss of a schoolmate and a tragic loss of a child ends up reverberating throughout the community, including through the schools. But we are not treating this as something that needs an environmental intervention. I know I'm going to sound like a broken record, but to prevent the flu, the best tool we have at our disposal is the vaccine. And if you get very, very sick and have symptoms, these are not sniffles and cold and cough. These are shaking chills, high fever, body aches. You should see a doctor immediately because the second line of defense after the vaccine are antiretroviral HIV coming up, antiviral agents, which are also in good supply in the city. I think Councilmember mentioned that, and it's very good advice.
Councilmember also mentioned that the vaccine, there's talk about the vaccine not being as effective this year. Can you speak to that at all?
Well, as the council member, I should, I don't know, you have a steep, he's had a really rapid learning curve, as he pointed out, and it's completely correct. We really can't assess the efficacy of the vaccine during the flu season. But there are other jurisdictions that have shown low vaccine efficacy. We don't know yet and won't know for a couple of weeks how effective the vaccine has been in our setting. But I want to reiterate again the 2 points that we've been making about the vaccine. One is the vaccine for the type of strain that we've had circulating, H3N2, which in 2014-15 caused quite a severe outbreak. You can see, though, that we've surpassed it. Those are national data over there. The efficacy is usually about 30%. So that means that you reduce your chance of getting the flu by about a third. So that's, not zero. What is a 0% protection is not getting a vaccine. That will give you zero protection. And so we don't yet know what the vaccine efficacy is. It may not be as high as we'd like it to be. It's always worth getting the vaccine.
These numbers on emergency room visits, 6.5%, can you kind of put that in some context? What was it the last few years, and what does that translate to in absolute numbers of people going to the emergency room or being hospitalized?
In terms of the previous year, it peaked at about 5%, so that would be 30% higher than it was last year. And in terms of the absolute number of emergency department visits, we're going to have to get back to you. It's thousands and thousands and thousands of visits.
Did you say that last year there were 4 or 6 pediatric deaths?
There were 6 when the season was over.
Not up to this point.
Up to this point, there had been 4. By this time last year, there had been 4 pediatric
Why
deaths.
is then this season worse than last season? Why do you think it's...
Well, we measure worse in terms of numbers of cases, numbers of hospitalizations, and also in terms of the trend line. As you can see, it's still going up. So we don't just measure it in terms of pediatric deaths,
Do you have any evidence,
which are fortunately quite rare.
do you have any numbers or anything to kind of track the level, the extent to which people are heeding these warnings about getting the vaccine?
Oh, great question, because we do. I almost feel that I should turn it over to the person who generates those data, because in preparing to meet with all of you, we looked at the data that we have from our childhood immunization registry, and we are seeing an uptick in vaccinations being reported to the registry. So that is encouraging to us. It suggests that people in the month of January, because that's the month that we can look at, these are really real-time data, are heeding our call and listening to the news and going out and getting their children immunized. We want to say keep it up. We want to see those numbers continue to rise.
Well, where does that data come from? Doctors' offices, or how?
It comes from doctors' offices. We have, and our clinics and outpatient departments. This is a wonderful resource that we have as a city of keeping track of immunizations. It means that parents don't have to keep those pieces of paper. And it's also a way that we distribute the free vaccine that we get from the federal government.
Would you mind just sharing some of those specific numbers in terms of what you're seeing this year, how many this year, how many last year, how many?
In terms of numbers of immunizations reported to the Childhood Immunization Registry, do you have those, or?
We'll have to get back.
We'll have to get those we'll have to get back to you, but we believe that we have very good capture of childhood immunization rates through our registry here in New York City.
If somebody's been to the doctor and they're confirmed to have the flu, and they go home, they're not doing better, what are the signs that they're not doing better and that they should take themselves to the emergency room?
So it's continued symptoms, difficulty breathing. If you're either a patient with a diagnosis of a flu or flu-like illness and you experience those symptoms, continuing to feel terrible, having any difficulty breathing, or if you're a parent of a child, you should get yourself back to the doctor. The earlier that antivirals are started, the more effective they'll be. And we want to see them administered to people with serious flu illness.
So if more parents are getting the shots, and there's plenty of vaccine going around, why the spike?
Well, it's a combination of things. One is, despite our best efforts, every year people have to get the flu shot. And I won't embarrass all of you by asking how many of you haven't gotten around to getting your flu shot. I hope you will go get it. But there continue to be many people who haven't gotten the flu shot. In addition, this particular virus that we're seeing this year, the H3N2 virus, is a wily virus which has proved difficult to find a highly effective vaccine for. That doesn't mean that it's not protective, as I keep reiterating and as the council member really stressed. We need to stop this idea of don't bother to get it. But it is a difficult virus to create a highly effective vaccine for. These are multivalent vaccines. They work against different strains of the flu. We see different strains of the flu, but this year the most prevalent strain is the H3N2. The other strains we know that we have really pretty good vaccine efficacy for based on historical data. The whole process of making these vaccines is one that we all wish were better. The vaccine is based on the circulating strains of the previous season. So round about now, the vaccines for next season are being planned. This is a wily virus that changes over the course of a flu season. And so we create vaccines that are based on best guesses. And every year you have to get the shot because every year is a different flu season. And that means that we have to keep coming back to people and telling them again and again, get your flu shot. And I don't need to tell all of you how important it is not to let people get weary of that message. We need them to heed it.
According to the state health department, and this may just be a reporting thing, Queens has more lab-confirmed cases than any other county in the state. Is that just maybe better reporting or a population issue?
I'm not aware of those data, but obviously in order to be a lab-confirmed case, you have to go to a doctor, have a swab taken, and have your specimen sent to the lab. So it's a combination of surveillance, who gets the swab sent to the lab, and the occurrence of flu. We have flu prevalent across the United States, across our city. We don't think that there's any borough of the city that's harder hit than another.
Two more questions. Inevitably, people are going to say, I don't count on my boss saying I can take off because I've got the flu. And many people are going to say, the city may say that I can count on paid sick leave, but are they going to be there for me when my boss says you can't take off? What guarantee can you offer, if any, that that can stick in any New Yorker's situation?
You know, I can tell you that we take retaliation cases very seriously, right? If you actually try to take your sick day and you got fired, or your employer, I don't know, discipline you for some reason, right? Or you file a complaint with us. We investigate retaliation cases. We go after employers and we find them if they do not provide the right. Until now, I think from the moment we started enforcing, we've collected over $6 million in restitution for unpaid sick days and in fines. So we're very active enforcing this. We have teams of investigators and lawyers who are, receiving those complaints and going through those cases. You can call if you have you can call with an anonymous complaint and we'll take that. So part of it is again, reminding people that the right is available, doing a lot of outreach, we have teams of people who go to the communities and make sure that people understand their rights. We have our materials in I don't know how many different languages. So it is always going to be, it's not perfect right now, but we're trying our best to get the message out, and we are very seriously enforcing this law.
And if someone has a complaint, how do they go about filing? Just call 311?
You call 311, those calls get right to us, and we take the information over the phone, and then interview the worker. And oftentimes what happens is when we go and investigate an employer, we investigate the entire workplace, right? So we're not picking on just one person's information to make sure that we're protecting them. So it's very simple, either through the website, right, calling, visiting nyc.gov / paid sick leave, or 311.
Have you seen a spike in complaints this year, the same way that you see a spike in cases?
I don't have numbers right now. Maybe we can try to get you for this year, right? I would say to you, last year we got approximately 340 complaints of paid sick leave cases, and we also did investigations on our own without complaints. But we can try to get you numbers for this year.
What is your message for the
Yes, it doesn't matter if you have, it doesn't matter, your immigration status does not matter at all. If you worked, you are entitled to these rights. It's the same for many other workplace laws that, state, local, and federal laws. But so you are protected the moment you work, you have this right.
Can I just say something on that point? Lo voy a decir en español. Si usted es indocumentado, usted tiene si usted es indocumentado, usted tiene derecho a ir a cualquier hospital público y recibir una vacuna a la gripe, gratis. No se va a preguntar si usted es ciudadano, si usted tiene documentos, no importa, usted tiene ese derecho. Y como bien dijo la comisionada, tiene derecho de coger un día libre si está enfermo. I was just making the point that undocumented immigrants in New York City have the right to go to any health and hospitals facility and receive the flu vaccine for free, and they will not be asked about their status or their citizenship or the documentation. In fact, we have passed laws in the city that prohibit ICE from going into public hospitals. So that's a safe zone, and no one should be fearful. You should take care of your health no matter your documentation status.
As far as the sick days, you mentioned this accrual function that I wasn't aware of previously. Obviously, it's close to the beginning of the year, so does that mean if you don't have anything left over from last year, do you not actually have the full 5 days available right now?
If you did use your 5 days last year, you do not have, you need to accrue them again this year. So for every 30 hours, you'll accrue 1 hour of sick leave.
Okay, so someone who right now in this point of the year can't actually necessarily take off.
If they used their 5 days last year, yes, that's what the law allows. Some employers give more time, right? But right now, if 5 days is the minimum. And again, yes, if you used all your leave, you will have to begin accruing again this year.
Any other questions?
Can you talk about why the information is kept private on the 2 child-related deaths? Does it have to do with the HIPAA laws?
No, it has to do with our obligation to protect people's personal medical information. Our health department is the proud repository of a great deal of information that helps us understand the health of our city, but it also gives us the obligation to protect people's privacy.
Why did the police department then release so many?
You'd have to ask the police commissioner.
So our children, I'm sorry, go ahead.
I was just, so there's not the same obligations with the police, I mean, there's not.
I really can't answer that question. All I can do is reiterate that the health department takes very seriously its responsibility to protect private medical information, and we will not be providing any further details on this tragedy of 2 children who have died of the flu. And we don't provide that information in general. I just wanted to add to the remarks that Councilmember Levine made, that we also at the health department have an immunization clinic in the Fort Greene section of Brooklyn. It's readily available on public transport. Like our public hospital system, we ask no questions about immigration status. We also will provide people with flu vaccine without, regardless of their ability to pay.
Just about the number of cases from
Sure.
More cases, or is there more testing? Is this year particularly bad in terms of?
This year is particularly bad, and not just in New York City, but across the nation. As you saw, the flu is prevalent in every single state of the continental United States. And in our part of the United States, the number of cases continues to rise. It's verified by the number of influenza illnesses that we're seeing in emergency departments and outpatient clinics, by the number of hospitalizations, and by the rising number of laboratory-confirmed cases. It's not an artifact of surveillance. It reflects the prevalence of influenza in our population. That's why it's so important to leave you with a message that it's not too late to get a flu shot. If you haven't gotten your shot, please go get a flu shot. If you're a parent of a child who hasn't had flu shot, talk to your doctor or consider going to a pharmacy to get that flu shot. It will help prevent the flu, and if you get symptoms, will make it less likely that you have any serious complications. But should you get sick, the second line of defense are antivirals, and we want people to seek care early for the assessment by a clinician of whether they ought to be on antivirals for the flu. I think that's
Thanks,
it.
everyone.
I want to thank you all. Thank you for being good-natured about our elevators. It's not a city building, by the way. Thank you.